Hi everyone. I hope you've found the previous video on healthcare system useful. In this video, we are going to talk about models of healthcare system. There are various healthcare models that are used across the world and they shape the healthcare delivery, and there are advantages and disadvantages of each model. And I think it is important to understand them if you would like to understand the healthcare system of any particular country, especially the one in which you are working. So as I said, there are different healthcare models that shape healthcare system around the world. Having said that, none of the systems is perfect or meet all the needs of the population that they serve. So all of these models have their own strengths and weaknesses, and we are going to have a look at those strengths and weaknesses. There are four main models around the world, excluding USA, in which there is no single nationwide system of health insurance or a particular model. So there are a combination of things are used. So four models. These are Beveridge model, Bismarck model, National Health Insurance model, and out-of-pocket model. The Beveridge model was proposed by William Beveridge, and in this model, the healthcare organizations are funded by direct income tax deductions from employees, employer, and the self-employed people who are working in any country. Healthcare is provided free of charge to everyone living in that country. Hospitals are owned and operated by the government. Healthcare staff, including doctors and nurses, are employed by the state. And various countries where this model is used includes UK, Spain, Cuba, and New Zealand. In fact, the model was first introduced in the UK, and UK's NHS system is based on this particular model. Then we have got the Bismarck model, which was proposed by Otto von Bismarck. So this model is funded by insurance payments made jointly by employers and employee. Patients or people who pay into these schemes have access to sickness funds, which are used to pay for health services. You may have seen that used in some of these places here as well, where people have got insurances through their employer and they're able to access services when needs be. Hospitals and health services providers are private institutions. Having said that, insurers are not allowed profit, and the price of health service is tightly controlled by law or the government. Example of the countries where this model is used include France, Germany, Japan, Switzerland, and etc. Then we have National Health Insurance model. National Health Insurance model is a model where a combination of Beveridge and Bismarck models are used. The government is a single payer of all health services which are provided. Funds are raised through a state-operated insurance scheme that every citizen pays into, and the insurance programs is not for profit and no claim is denied. The majority of health service providers are privately owned companies. And the example of this particular model include Canada and South Korea. Finally, the out-of-pocket model. As the name suggests, in this model, people pay for the medical treatment they receive. There's no universal insurance system or no income tax system into the country which funds the healthcare services. Most common in developing countries. Health services are not always available, and even when they are, they may not be accessible or affordable to people. And the example of the countries where this model is used include India, China, Africa, and South America. This table provides a comparison of all these four models, and you can see that most of these models all of these models have got some advantages and some disadvantages. So the Beveridge model, the health services are free. Everybody living in the country has got access to services. The cost is low because there's only one buyer, which is the government. So there's less room for the companies to play up. And citizens are not responsible for medical bills or paying it themselves. It's just the state's responsibility, and it works like that. Having said that, the disadvantages of the model are that there could be pressures on the healthcare services, there could be long waiting queues for people, and the funding of the system is really difficult because usually it is the money is taken through taxes, and in countries where there is aging population, it becomes the number of people who are working becomes much less, and which then means that it is difficult to fund the system and make sure that everybody is covered. Every citizen of the country has to pay tax, even if they use the healthcare services or not. The other model, Bismarck model, again, it covers those people who paid into the system, and they don't really have to worry about the expensive healthcare bills that they might get as a result of using the services. Administrative costs are low, and again, because there is one buyer or the government tightly controls it, so therefore the system is quite controlled. Waiting time for services could be much less than, and that's one of the advantages, depending on what kind of insurance you have, because you will see the same thing is written as a weakness of the or disadvantage of the model as well. In terms of disadvantages, not everyone would be able to benefit from the scheme. People who do not pay the insurance would not be able to use that. The services may not be available in rural areas. People have to pay higher taxes. For elective and secondary and tertiary services, there may be longer waiting list where people have to, like, for example, if you were going to to get a knee operation, because your knee was not working properly, it may take longer for those operations to be organized. Again, the national health insurance model, again, universal healthcare access is available, centralized management of the insurance is possible, so which then means that cost is low, and people are still given appropriate services. Having said that, the waiting list could be very, very long and could affect the provision of services. And finally, the out-of-pocket model, while waiting time is less, services may be responsive to people's needs. The cost could be really high, and availability of services could be very difficult, and services may not always be of that quality or affordable for people. So let's conclude this. So there are 4 healthcare models in the world, and countries choose to adopt their own forms of healthcare that consist of a mix of any of these 4 models. So there are very less countries where you will see only one model working at one time. Usually there's more than one model which is used in different countries. No healthcare model, as I said earlier, is perfect when executed in reality, and we must continue to strive to improve the care available to every person, regardless of the nationality and the country they are in. Thank you for listening, and I hope you have found the video useful.